I'm Nicholas Crisp. I'm Deputy Director General for the National Health Insurance in the National Department of Health, and the health technology assessment responsibilities fall within my branch. So I guess the question people will ask is, what's health technology assessment and what are we trying to achieve? And the short answer is that what we are trying to achieve is a way of having evidence-based, fully consulted inputs on what technologies, and I'll come back to that, are used by the health system and paid for by the National Health Insurance Fund going forward. That's the short answer, but it's a little bit more complicated than that, because technologies include medicines, medical devices, diagnostics like laboratory services and radiology, but it also includes the surgical procedures and the other ways that we deliver healthcare to the public. And the question is, ultimately, what benefits is the National Health Insurance Fund going to pay for? And how do we make sure that when we pay for those benefits, all the things that we do within that benefit, the consultations, the surgical procedures, the laboratory tests, the vaccines, and everything else that we use to provide that benefit, how do we make sure that there's evidence that those, let me call them goods, the stuff, if you like, that we use in that care is appropriate, up-to-date, optimal, affordable, and satisfactory to the patients? Because we live in a context of a certain society, and we live in a space where not everybody will find the same kind of care acceptable and appropriate for them. So health technology assessment has been around for a very long time. Other countries have had agencies that have been assessing products and procedures for anything up to 20 years. We're a little slow off the starting blocks to formalize this, but there has been a form of health technology assessment in the public sector through the way that we determine the medicines we include in our standard treatment guidelines. And the medical schemes have all had some form of health technology assessment for some time now, because they have needed to decide what to incorporate in what they are going to pay for in the various packages that they offer. So our hope through what we've been doing the last 2 days is that we will now bring all of this knowledge, which is substantial, all the expertise and the skills, which is significant, plus what we've learned from our interaction with colleagues around the world, particularly in the UK and Thailand, where we work very closely with them, and we will be able to formulate a very structured way forward in South Africa, where all of these role players, public and private, academic and lay persons, including patient representative groups, have a say in the method by which we select these technologies. So have we achieved our goals? We certainly managed to get a very big audience, and there's been a huge amount of interest. We know that this now needs to be formalized, and the first step of that will be there was a technical working group who's prepared for this stage of where we are now. We are about to appoint a ministerial advisory group or committee. The minister will be appointing, once we've been through all the applications and made sure we've got a very balanced set of skills and expertise. And that Ministerial Advisory Committee will now spend time putting all of these consultation processes into practical format. Ultimately, the National Health Insurance Act says that the country will form an entity, an independent entity, which will be the agency for this country to do these health technology assessments and feed that into the process of the choice of benefits in the National Health Insurance. So it's going to take a long time, but yes, we are very happy with the level and commitment of participation, the huge range of stakeholders who have been present, the views and the comments that have been made, and the way forward that each of the working groups has brought for us. Thank you.
Good morning, I'm Jeanette Hunter. I am the Deputy Director General for Primary Healthcare at the National Department of Health. We are here at the second day of a 2-day national symposium on health technology assessment. The symposium was organized by the National Department of Health in collaboration with the South African Medical Research Council. The aim of this symposium is to get from a diverse group of individuals in South Africa's health system, both the public health system and the private health system, to get input from this diverse group in order to develop our national strategy for health technology assessment. The aim of the strategy is to guide South Africa to spend our health rand in the most equitable manner, to make sure that what we get with the health rand for South African communities is grounded in our local realities, and we could get the best possible outcomes in this manner.
Hello, I'm Andy Parrish. I'm a retired prof of internal medicine at Walter Sisulu University, and I used to be head of department at Freya and Cecilia Makiwane hospitals in the Eastern Cape, in East London. My interest in health technology assessment goes back a couple of decades, but the point of the process really that excites me most is the fact that it allows us to tie quite clearly the evidence for any intervention or equipment or medicine that is used in healthcare to the underlying information that allows us to assess whether it really is an effective and trustworthy and worthwhile part of our armamentarium. And the reasons for doing this is it's quite often the case that we take on board things which may not be that effective, may be very costly, and may also have side effects which are quite severe. And being able to assimilate all of that into a simple dossier around any single intervention really is the whole process of a health technology assessment, and it makes it much easier to understand what the components are of the health system that we are essentially funding through our tax dollars. So that's my approach to HTA. Thank you very much.
Hi, I'm Tamara Credo, and I'm the Director of the Health Systems Research Unit at the MRC, Medical Research Council.
Hi, hello, I'm Professor Liesel Zunke. I'm the Vice President of the South African Medical Research Council.
And we've been so excited to be at this symposium the past couple of days. We're a day and a half in, just about. And the whole symposium is about how do we make sure that as the country moves towards NHI and we try and realize better quality care for people, that decisions that are made are transparent, are trustworthy, are inclusive of people and the public. And it's really been a really interesting conversation, bringing all sectors together to talk about what are they currently doing, what can we learn from each other, and how do we build this up so that we create a system that is actually speaks to and is particularly for patients, the public, communities. And so it's been really exciting. Every conversation has brought that up, Liesel, in the past couple of days, is where are the patients, where are the public in this conversation? And so I'm really happy to see that as a focus.
Yeah, that sounds excellent, Tamara. The South African Medical Research Council is really excited that we co-hosted this event. We are mandated to advance the life of South Africans, and so this is really how we do that, using either technology or medicines, but using them in the most appropriate way, and using them in a way that represents teamwork and collaboration. And having these multiple stakeholders in the room really thrashing out all of these issues has, I think, been really important, and I think will actually bear fruit quite quickly. We talked about immediate next steps, priorities, how to amplify the voice of the community in this process. So we're really excited to see where this is going, and I think the symposium has been a very important first step.
Yeah, absolutely.
Thank you.
Thanks.
I'm Lauren Pretorius, CEO of Campaigning for Cancer and committee member of SATAG. Today we're here representing patient and citizen involvement in health technology assessment and are delighted that we are able to share with Summit members the importance of this. Patient and citizen involvement is something that's often overlooked in health technology assessment, but is vital to understand the preferences, the quality of life, and the ethics when it comes to decision making. Value-based care is something that we need to incorporate in universal health care, and the voice of the patient is something that needs to be incorporated in these decision making.
Good day. My name is Moremi Nkosi. I work for the National Department of Health as the Chief Director for Healthcare Benefits and Provider Payment Design. I'm here to talk a bit about health technology assessment and the symposium that we've been having for the past 2 days. Health technology assessment is a mechanism that looks into the effectiveness of products, medicines, and consumables that are utilized in the provision of healthcare. It's a mechanism that's widely used to support policymakers, researchers, but also decision makers around the appropriate interventions and devices that should be used in the provision of healthcare so that users and the general public benefit the most from these. The symposium that we're having is very important because it helps to set the tone in dealing with health technology assessment in a very coordinated and integrated way. Currently, what we have is a number of stakeholders in the country, both in the public and the private sector, undertake health technology, but utilize different perspectives or approaches to making decisions. The symposium brings together a wide range of stakeholders from the public and the private sector, but focusing on ensuring that we all understand health technology in a similar way and start having conversations about what is the best way to integrate the processes and systems that we use for health technology assessment, so that users, whether they are accessing healthcare services in the public or the private sector, are accessing the same quality, effective, efficient, affordable, and sustainable interventions and services to the benefit of their health outcomes. The symposium sets the tone for how best the public and the private sector are going to continue working together in various aspects that touch on health technology assessment. An example of this would be how we deal with data and information that is used by the experts in making decisions and reaching a conclusion in relation to how best to fund and pay for a particular intervention, whether it's being utilized in the public or the private sector. The ultimate objective is to have a very integrated and streamlined approach that ensures that the way our HTA ecosystem operates is integrated, sustainable, but most importantly makes decisions and ensures that all users in the country are accessing services in a manner that is consistent with the principles of universal health coverage and ultimately contributes to part of our processes in terms of achieving phased progress towards UHC through the phased implementation of national health insurance.